The aim of the session today is to improve your understanding of knee osteoarthritis and the ageing knee, and to summarise the most current advice when it comes to managing your symptoms. In this session, we'll aim to cover what is knee osteoarthritis and the ageing knee and how it can affect you, pain medications, the importance of a healthy lifestyle, common misconceptions and myth busting, exercises to help manage your symptoms, and where to look for further information about the management of your knee symptoms. It's important to note that with knee osteoarthritis, it's normal to experience variations in your knee pain and stiffness, especially when starting a new exercise regime. However, if your symptoms worsen at any point and you're concerned, please contact your GP practice for more personalised assessment and advice from a first contact physio, or you can self-refer to your local hospital-based physiotherapy team.
The knee is formed between the bottom of the thigh bone, the femur, and the top of the shin bone, the tibia. The ends of the bone are covered in a smooth, slippery surface known as menisci or cartilage. The menisci are C-shaped tissues inside the knee joint located between the thigh bone, the femur, and the shin bone, the tibia, the cartilage surfaces. The menisci work like a shock absorber, supporting the load by compressing and spreading the weight evenly within the knee. In osteoarthritis, the protective cartilage that cushions the ends of the bones wears down over time. This, along with the degenerative menisci, is a normal part of the ageing knee. It is a natural process which develops as we age. Many of us will not be aware that our knee is naturally aging, as we are able to continue to function normally and remain pain-free. However, you are more likely to develop pain if you overload the joint, have a traumatic injury, or are overweight. These can result in the knee becoming sore. Diagnosis is made from your symptoms, the history of the problem, and an examination of your knee. Tests such as X-rays and MRI scans are not normally needed unless surgical intervention is required. To help understand how ageing affects the knee joint, we will watch a short video created by Versus Arthritis.
What is osteoarthritis? Osteoarthritis is the most common type of arthritis. It affects around 9 million people in the UK and is more common among women. In most cases, people are over 45 when they get it. It can cause pain and stiffness in joints. The most common joints to be affected are the knees, hips, back, feet and hands. To understand what happens in osteoarthritis, let's first look at how a healthy joint works. A joint is where two or more bones meet. They allow bones to move freely without letting them move too far. A joint is held together by a capsule and ligaments. There is a soft inner lining to the joint called the synovium. A thick fluid is made by the synovium which protects the joint and helps bones move freely. Thin layers of tough, slippery tissue called cartilage act as a protective cushion to stop bones rubbing against each other. Muscles are attached to tendons, and tendons are attached to bones. Our muscles pull our tendons, which in turn pull our bones. Osteoarthritis starts when cartilage starts to thin or roughen. This can happen naturally during the aging process. There are also things that can make this more likely to happen. For example, being overweight or an injury. Once the cartilage has started to thin or roughen, the body puts in place a repair process to try to make up for the loss of cartilage. The repair process may work well, but can sometimes cause further problems. New bits of bone may grow within the joint. Extra fluid can also build up inside the joint. The extra fluid and the new bits of bone can cause swelling and may force the joint capsule out of shape. If you have osteoarthritis, try to maintain a healthy weight and keep moving as much as possible. Exercises to strengthen the muscles around the joint can improve symptoms of pain and stiffness. Taking painkillers can help you stay active and exercise. It can be tough having osteoarthritis. However, remaining physically active and continuing with your hobbies, normal routine and social life can help you manage your condition.
Pain relief can be an important tool to help you manage your knee pain. The National Institute of Clinical Excellence, or NICE, is where clinicians get their guidance for what medication to offer and when. They advise the first-line treatment should be topical anti-inflammatories. Topical means a gel or cream which is applied directly to the painful area. An example is ibuprofen gel. If these topical treatments are ineffective or unsuitable, you can consider using oral anti-inflammatories. Oral means they are taken by mouth in a tablet, capsule or liquid form. It may also be necessary to take other medications alongside anti-inflammatories to protect the stomach. An example of an oral anti-inflammatory is ibuprofen, which is available over the counter. Other stronger anti-inflammatories are available on prescription. Paracetamol or weak opioids such as cocodamol should not routinely be used, but can be considered if the above treatments are ineffective or ruled out. If paracetamol or weak opioids are used, they should only be used infrequently and for short-term pain. Cocodamol already contains paracetamol. Please do not use any other products containing paracetamol alongside this medication. You should be aware that there may be reasons you are unable to take these medications. If you are unsure, you should speak to your pharmacist or your GP. It is important to note that if medication is needed, they should be used 1. At the lowest effective dose for the shortest possible time, and 2. Used alongside other non-medication based therapies to support exercise. When it comes to arthritis, the risks of using strong opioids such as morphine, oxycodone or fentanyl outweigh the benefits. Remember, we are here to manage your long-term health as well as the current episode of pain. Steroid injections can sometimes be considered as a means of pain relief if the other medications previously mentioned are ineffective or unsuitable. It should be noted that joint injections only provide short-term relief and should only be used for moderate to severe pain and alongside other treatments such as exercise. Using heat and ice is a simple, cost-effective and safe way to try and manage your pain and other symptoms such as swelling, which may be present when you experience a flare of osteoarthritis. We would generally advise that you use heat for pain relief when your knee is stiff and achy, whereas ice may be more effective for a swollen knee to reduce any inflammation. Alternating between heat and ice can also be effective to provide pain relief. The link between body weight and joint pain is well documented. Simply put, the heavier you are, the greater the strain on your joints, resulting in higher levels of pain. This means that reducing body weight and maintaining a healthy weight over time can help manage pain. The most effective way to reduce or maintain weight is through a combination of healthy eating and regular exercise. This can be achieved by reducing portion sizes by a small amount and increasing daily exercise levels. Unfortunately, there is no strong evidence that indicates that any one diet is good or bad for joint pain. The focus should be on eating a balanced, healthy diet. This diagram shows how much of each food group should make up your daily food intake. 1/3 fruit and veg, approximately 5 portions a day. 1/3 starchy food, whole grain, high fibre options are ideal. The last third is made up of protein sources, for example fish, chicken and meat, and fat from dairy products such as oils and spreads. You should try to have 6 to 8 glasses of water a day, which can include tea or coffee, while drinking no more than 150 millilitres of fruit juice or smoothies a day. If you require further support with weight management and healthy eating, you can contact your GP surgery or self-refer to the Wellbeing for Life team on 0800 8766 887. Part of a healthy lifestyle includes making positive lifestyle changes such as stopping smoking and reducing your alcohol consumption. The NHS guidance is to avoid drinking more than 14 units per week on a regular basis. Both smoking and drinking alcohol have been proven to cause a number of serious health conditions. The NHS has smoking and alcohol services to help you make positive lifestyle changes.
Knee osteoarthritis progressively worsens over time. Osteoarthritis does not necessarily get any worse over time. The amount of pain that you experience does not always mirror the amount of degenerative change within your knee. Using the advice provided can reduce your knee pain and stiffness and improve your overall knee function. Exercise is bad for my knee pain and will wear out my joints. Many people think that exercise will damage their joints, but that couldn't be further from the truth. The reality is exercise helps strengthen your joints. That's because the more you exercise, the stronger your muscles, tendons and bones will get, which will support your joints. Exercise also helps maintain a healthy weight. Exercise is one of the most important treatments for people with osteoarthritis, whatever your age or fitness level. Pain with activity means I'm causing more damage to my joints. It's not uncommon to feel slightly sore and achy after exercise. In fact, this is normal. If the pain continues for more than a day after exercise, don't panic. It just means you've done a bit too much and doesn't mean you've caused any damage to your joint. You might just need to make some changes to your exercise routine.
Evidence shows that exercise for knee pain can be helpful to manage your symptoms. This is because the muscles surrounding the knee help to support the joint. Completing targeted knee exercises can help to strengthen these muscles and keep the joints lubricated. This helps to reduce joint stiffness and pain and to protect the knee. As well as strength exercises, aerobic exercises such as walking, cycling or swimming all help to maintain a healthy knee joint. These activities should be performed so you feel a little out of breath and start to build up a sweat. Try to aim for a minimum of 150 minutes of exercise each week. This could be a combination of aerobic and strength exercises. If you have any health or medical concerns about beginning an exercise regime, make an appointment with a healthcare practitioner and discuss it with them first. When starting a new exercise program, it is important to gradually increase the amount and frequency of exercises. You may notice an initial increase in pain when starting a new exercise. Don't worry, this is perfectly normal. Just do less repetitions next time and gradually build up again. It's important to know that this may take up to 12 weeks to notice an improvement. It is important to be consistent. We are now going to demonstrate some exercises you can complete at home to help manage your knee pain. Knee bends. Sitting on a bed with your legs straight, slowly bend and straighten your knee. Bend and straighten your knee as far as you are comfortable to do so. Repeat this movement. If you are uncomfortable sitting with your legs straight out in front of you, you can also complete this exercise sitting in a chair. Static quads. Lying on your bed, push your knee down into the bed and straighten the affected knee. You should concentrate on tightening the thigh muscles to straighten the knee. This is a low-level exercise and ideally you should aim to progress. If you feel this is too easy, please try the following exercises. Straight leg raise. Lying on your bed, flat on your back, straighten your affected leg by tightening the thigh muscles. Raise your leg about 2 to 3 inches off the bed and hold this position. Try to keep the knee as straight as you can. Aim to hold for 5 seconds and repeat several times until you feel fatigued. You can then repeat this process 2 to 5 times. Squats. In a standing position, hold onto a chair or work surface for support. Squat down and then stand up tall again. Keep your feet flat on the floor, legs nice and wide, and slow the movement down. Aim to do as many as you can and then rest and repeat 2 to 5 times. If you feel pain, you can reduce the depth and the number of repetitions or try the above exercises. Step-ups. Using a step, stand up tall, holding onto the handrail for support. Step up onto the bottom step with your affected leg. Then step down with your non-affected leg leading. Aim to repeat this several times until you feel fatigued. With all of the exercises demonstrated, it is important to complete as many repetitions to become fatigued. This is the best way to challenge yourself and make progress. This is a basic exercise program. To progress further, you may want to consider buying some home exercise equipment. Alternatively, you may wish to join a gym or sports club where staff can provide you with further exercise guidance. Online resources such as Escape Pain can also provide further information on exercise and management of the aging knee. You need to look at the list provided at the end of this talk for further information.
So in summary, we know that knee pain can affect many aspects of your life. In this session, we've highlighted lots of simple things you can do to help reduce your pain and improve your knee function. Aim to look for positive strategies to help you and your knee cope. Remember to stay active, socialise, but respect what your knee can tolerate. Your pain can really affect how you feel, and look at strategies to address this and ask for help if needed. Look for adjustments at home or in your workplace, such as footwear, rotation of activities, and speak to your workplace occupational health department to see how they can support you. Knee pain can affect your sleep. By improving your pain management, your sleep will hopefully improve too. Good overall health can improve your symptoms, and you can influence your general health, including body weight, healthy eating, and keeping active. Optimise the use of your medication. There are support networks to help you to cope. Here are a list of groups and links you might find useful. What happens now? You now have a few options. The first one is self-management. If you now feel you're able to try and manage your symptoms, try and make some changes to your daily routine and lifestyle as we've suggested. By doing this, you should notice an improvement in your knee pain over the next 3 months. Further support. If you would like further information and advance on managing your knee pain, the Escape Pain programme may be of benefit. You can do this online or in person via referral from your local physiotherapy team. Physiotherapy and onward referral. If you would like further assessment of your knee, you can self-refer to the NHS physiotherapists in County Durham and Darlington using this link, or you can get a paper copy of the referral form from your local GP surgery. You should present to your GP, physiotherapist, local urgent care centre or A&E if your knee suddenly becomes red, hot and severely swollen with or without a fever, the knee becomes immediately swollen after injuring or twisting your knee, or if you have difficulty putting any weight on your sore leg. Most of the knee problems should settle within 6 to 12 weeks without seeing a healthcare professional. If your knee problem does not improve within 6 to 12 weeks or the knee pain is getting worse or your knee locks or gives way, it's recommended you seek advice of a physiotherapist or a doctor. Thank you for listening to this informational video about your knee. We hope you found it helpful.